Skin solutions can differ based on complexion. In this week's Healthy, Wealthy, and Wise segment, CBS 2's Dr. Holly Phillips talks with one of New York's top dermatologists about skincare for every shade.
New York is one of the most diverse cities in the world. According to the Census Bureau, 26% of the city is Black or African American. Close to 28% is Hispanic or Latino, and 12% of New Yorkers are Asian. Of course, there are countless other cultures in this melting pot of ours, so naturally there are just as many skin types, and each one needs proper care. With me today to discuss cultural skin solutions is Dr. Dina Strachan. She's a board-certified dermatologist in private practice in New York and an assistant clinical professor at Columbia University. Dr. Strachan is published and has spoken both nationally and internationally in her field. Welcome.
Thank you.
Well, everybody's interested in looking young. I'm sure you tackle this all the time in your practice. And chemical peels are incredibly popular, but are they safe for everyone?
Yes, chemical peels can be done on all kinds of skin. In the right hands with the right substances, everyone can enjoy the benefits.
Great. And you had told me something earlier about the history of chemical peels. That was very interesting.
Yes, chemical peels were actually developed in parts of the world where people have darker skin. If you think of Africa, Cleopatra taking sour milk baths, she was using the benefits of lactic acid, which is an alpha hydroxy acid, to improve the appearance of her skin.
That's interesting. And that's something that's actually in chemical peels today, that same substance.
Exactly.
Well, now what about those ever popular fillers? Restylane, collagen, Juvederm. Are they safe for all types of skin as well?
They can be used in all types of skin, just that people of different backgrounds age differently. People with lighter skin tend to wrinkle, African Americans tend to fold, and so you'd use those substances differently.
And what about skin cancer? Are brown skin people safe?
Not 100%. They have a lower risk of skin cancer, but there are certain types of skin cancer such as melanoma of the hands and feet, which can affect anyone, and in fact the rate is the same across all races, and African Americans tend to actually have a worse prognosis for that type of skin cancer.
That's interesting. Is that because they're diagnosed later?
Yes, that's one of the theories.
I'd like to take a viewer question. Sylvia from Manhattan asks, I'm a brown-skinned woman and I get tiny moles around my eyes just like my mother. Are they hereditary or does the sun cause them? I see this sometimes on people. It's sort of a common finding.
Yes, Sylvia probably has dermatosis papulosa nigra, which is a hereditary condition. The lesions aren't exactly moles. They're closer to warts, and it's cosmetic. They can be removed.
Excellent. Well, this has been great information. Thank you so much for joining us. And that's today's dose of Healthy, Wealthy, Wise. Back to you.
Sun protection is important for people of all complexions. Use a sunscreen with both UVA and UVB coverage anytime you're out in the sun.